Things are returning back to normal after the very contentious first half of the session, where we, with I believe was precedent-setting speed, passed out of committee and sent to the governor right-to-work legislation, which in my opinion will have a negative long-term impact on our state. But having said that, that issue has been debated and it is now signed into law. We have the second half of this legislative session to look forward to, where, again, I don't think it will be nearly as contentious, but we still have some very important legislation that we need to address. We need to look at school funding formulas to make sure that there are adequate funds available for public schools, private schools, charter schools, and perhaps virtual schools. So we have to make sure that all of those dollars are allocated properly. We still have some local consolidation bills that will be coming forward, particularly as it relates to nepotism and some changes there at the local level regarding that topic that we will have to look forward to. And we just heard in Health Committee today a bill that is looking at making Indiana a member of a Health Alliance Compact that will essentially shift all of the responsibility for providing health care to Hoosiers to the state level, and will have no regard at all to any of the federal requirements or the federal regulations. I can assure you that this is a bill that causes me grave concern, because I know that to make sure that we have adequate services for many of the poor and the elderly in this state, we have had to fight tooth and nail for those kinds of coverages for that population. And a lot of what we've been able to do is because there are some assurances from the federal government that certain programs will be put in place if we take their dollars. Well, what this health compact does, it will allow us to take money from the federal government in the form of a block grant, but we do not have to adhere to any of the federal government rules or regulations. Instead, as I said, leaving that to the state to determine. And I would encourage you that if you have an opinion on House Bill 1269, that you would contact your elected representative and share your opinion with them.